HealthAlliance has been working with the Department of Health for the last 16 months to seek support for a plan to redesign the delivery of healthcare in Ulster County. We are pleased to announce a decision by the Department of Health to award HealthAlliance a grant in the amount of $6.5 million to advance those plans. Our stated vision 18 months ago was to consolidate operations into a single facility. That was due to declining volumes, and that vision remains intact. However, after evaluating changes in local and national healthcare, the changing landscape, we believe that consolidation will happen after we complete 3 initiatives. Number 1, we need to do more physician alignment. Number 2, we need to work on and introduce to the community population health management. And number 3, we need to affiliate with a larger system. To us, physician alignment means a collaborative effort between us and our primary care physicians and our specialists to redesign the way healthcare is delivered to this community. The hallmarks of it will be increased care coordination and intervention so that we keep people healthy. It's a big departure for us in terms of what delivery means. We treat people when they are sick. Now we are going to intercede and keep them healthy. And the concept between population health management is really being able to look at analytics. We all have electronic health records. It's taking the information from those electronic health records and being able to treat the sickest among us by knowing what is wrong with them. And number 3, we need to work with a larger system. We're in an environment where single, small, even hospitals like us will not survive in the future unless we partner with somebody with a little more size. Our focus will shift toward outcomes, quality care, coordination, all resulting in improved care to the community. We will move away from volume-based performance measures and bricks and mortar. This announcement does not signal our arrival at the final destination, but really the beginning of our journey toward changing healthcare delivery in Ulster County.
We're talking about the future accessibility of quality healthcare in our community. It's incumbent upon this management team to save our hospital. It's incumbent upon this management team to ensure that accessibility stays going forward. We will fight day in and day out for the people of Ulster County. They have a significant investment in this process, not just in dollars.
My mom lives right around the corner from here. I grew up here on Andrew Street. My mom was also a product of then what was called, I think, the Kingston Nursing School. And in the 1950s, where she was graduated and certified to be a registered nurse, and she practiced her nursing for over 50 years and retired twice. I myself and my late brother TR, who was also the mayor of the city, were born at the Kingston Hospital. Lest we not work together as partners, then we all lose. The city, the county, the region. And we can't do that given the critical moment in Kingston's history. So once again, good luck, and I look forward to working with the good folks at the HealthAlliance.
It's a HEAL grant, and the way HEAL grants work is you, the hospital, need to spend the money, and then you voucher for reimbursement from the state. So when you voucher, you need to prove to them that you use the money for the appropriate purpose, and it's consistent with the plan that we laid out for them. The original plan spoke mostly of bricks and mortar, of expansion of one of the campuses to be able to consolidate. After extensive talks for those 16 months, we all drew the conclusion that probably wasn't the best way to go, that we needed to not build it first and then figure out how to use it, but figure out how to use it and then build it accordingly. Physician integration is really our ability to build, without getting into a lot of detail, is to build an organization that is a legal structure that allow physicians to operate as an economic entity without being employed by one employer. So the physicians will remain autonomous. They will be independent practicing physicians, but it will allow them to work collaboratively with us. About 18 months ago, we had reached out to our primary care physicians and asked them if they wanted to join a physician alignment group. At the time, they expressed interest, but they were exploring other employment opportunities. They've chosen to stay independent, so this is an opportunity for us to work with them.
What we're looking to do is partner with independent private practice physicians in a more financially integrated way, number one. Number two, to answer your second question, yes, we will continue to have technical staff and nurses and others that work with us within the facility. We're also going to see that population of employees grow, as Dave mentioned. Physicians, while they're not technically a shortage here in Ulster County, we're very blessed that way. Across the country, there's a physician shortage. So you're beginning to see a lot more healthcare delivered by nurse practitioners and physician's assistants. And that's just another example where we're going to begin to see movement in how healthcare is delivered.
Imagine a world where you'll actually feel better and the quality of life will improve. That you won't have to come into the hospital 4 times for pneumonia because you got the right care on this, what we call this medical perimeter. That there will be a host of caregivers wanting to, and the reason they're going to want to help you is because now they will be incented and paid rather than fee for service, rather than only getting paid every time you come into their office or every time they see you in a hospital or do a test on you. They will be able to share in the savings generated from keeping you healthy. We're going to change payment mechanisms. Instead of getting paid solely on fee for service, you're going to get paid based on shared savings. And shared savings means, and we'll use HealthAlliance as an example, it costs us right now on an annual basis $15 million to insure the population, the employees, and the dependents of HealthAlliance annually. Always remember, the hospital is the most expensive place to render care. We want to make sure that the care is rendered in the best place at the lowest cost, without compromising quality. It's a journey and it takes a lot of different partners, and it depends how fast each of these relationships develop. Changing the paradigm, as we said before, from volume to value. It's a fundamental shift. This isn't about us being bigger. This isn't about how we house, it's how we deliver.